Hello and good morning. Thank you for joining us with Win TV. I'm here today with Dr. Madye Henson McCannon. She is the Chief External Engagement and Impact Officer at Zion Church in Greenbelt, Maryland, located in Prince George's County. Dr. Henson, welcome to Win TV. How are you doing today?
I am wonderful. How are you this morning?
I'm doing great. I'm thankful to be joined by you, and I have just a few questions for what's going to be happening during your upcoming panel discussion, Black Moms Matter 2, which is happening tomorrow from 6 to 8 p.m. at Zion Greenbelt Church. Can you tell us about the event? The first issue is regarding the whole impact of the event. What are some of the issues that Black mothers face in accessing healthcare, particularly during pregnancy and after birth?
Access to adequate health care is a challenge for all underserved communities. And in our communities, the Black community, it is even often more pronounced. And so when we talk about that access, it is not also having affordable health insurance, it is having highly qualified doctors and clinics or providers for health that are there. But it is also having access to healthy foods. So all of those are things that actually impact what's happening to Black moms, and why oftentimes there are challenges that are more than in other communities around our own healthcare during pregnancy.
Thank you. For the next question, how can these social determinants of health, such as poverty and racism, be addressed to better offer care during birth and in the postpartum period?
Social determinants of health, or, whether it's poverty, racism, even our zip codes are social determinants of health. Saying where we live talks about what we have access to. And so when we talk about the equitable care, similar to it that I just mentioned, those are all factors that walk into the door as we walk in trying to get the health care that we need during pregnancy. And during this period, it's not just one, it's for two. So making sure that there is access to the things we need. The poverty is a foregone issue. When you don't have adequate resources, you are going to find that you have challenges getting anything that you need in in our society. Racism also plays a challenge in this as well. When you talk about having those that are highly qualified, those that are culturally competent, that are actually serving us in those institutions. So all of those things are determinants that play a part into what it looks like for us when we are pregnant and trying to have a baby.
All right. Thank you, doctor. For the next question, what role can Black pregnant women play in advocating for their own health needs, or for people who've already given birth, to advocating for the health needs of those around them?
Black women and those that love Black women who are pregnant can all be advocating in their behalf during this time. And that it means that you've got to speak up for yourself. You've got to request what you need. You have to ask the questions. And that begins at the first appointment that you go to. And also, without saying it, you need to make the first appointment. Whether you're pregnant, you know it, you think you may be, you need to be making an appointment. You need to get to that appointment. And you also need to be asking the questions and expecting to get responses that can help you in that walk during that time.
Okay. So for the next question, during the panel discussion, what other things do you plan to discuss for anybody that's in the audience or anybody who tunes in via stream?
So we won't be streaming this particular episode, this particular session tomorrow, just because of the confidential nature of it. So that speaks about the trust that Zion as a church looks at everything that we put in, and looking at, who is going to be there, who may access it, who may hear it. We want people to come in to get the information that they need, whether that be about fertility issues that they may be having, their insurance and how to get adequate insurance, how to go deeper in asking the questions, working with your own partners around what may be happening, both for them as well as for you in that time frame. Those are the kinds of things that we'll be talking about. We'll be talking about doulas. We'll be talking about care that you can get. Should you be looking at a doula to help you during this time frame? There are many questions that many women, particularly if you've never been pregnant before, but even if you have and didn't have adequate coverage or care the first time, these are places and these are the kinds of questions. And we've got experts that are going to be with us, that are going to help you answer those questions, but know the next steps that you should go to.
Okay, thank you. I only have two more questions, then I'm going to end with two stories that I can give you about positive updates regarding health in the state. That'll be our closers. So,
Okay.
next question. Who is your intended audience? Who do you think will learn if they come to this conference? You already said Black pregnant women and those who love Black pregnant women. Anybody
Right.
else?
That's a lot of people, isn't it? Right? Those who love. So whether that is, your immediate family, that's a mother, that's a partner, that's a spouse, that's children of them either. Who can learn about what are those things that we could be doing? Because when you're in the middle of a crisis, oftentimes you yourself can't see everything around you. So having a village around you will help make sure that you get the information you need and the support that you need as well. We also say that, when we talk about Zion as a partner around this, why have we stepped into this work? We've taken health and wellness in our community head on. We're looking at and have been working for years in providing information, bringing clinics to those that can't have access to them. So we've been very serious and very focused around it, and we've partnered with others that are doing the same, including CCI Health, who came to us around our access to women, United Way and National Capital Area, and many other partners who are saying, this is the time, this is now, and we all need to be in this work.
Well, thank you. The last question I was going to ask was about CCI, but you already
Yeah.
answered it. To wrap up, I have to thank you, Dr. Madye Henson McCannon, for joining us. A couple of positive updates in our state, and especially around Greenbelt. Luminous Healthcare should have a story in our paper next week. They plan to open a women's health center at their Lanham location that's not that far away from Roosevelt High School. I
Excellent.
spoke with the president there. That's one of their main goals because there is not, they outright said there's only one acute care center in that area. And also, a senator from Charles County is looking at bio research that can help to determine more rare conditions because there's a lot of conditions that primarily affect Black
Yeah,
folks that don't get the proper research. I
that's
want
it.
to say again, Dr. Madye Henson McCannon is hosting Black Moms Matter 2 tomorrow from 6 to 8 p.m. at Zion Church in Greenbelt. She encourages everybody to come and attend so that you can learn about how you can better protect the Black pregnant woman, the potential Black pregnant woman, or the Black woman who just gave birth and the baby. Is there any final words you'd like to give to our audience before we tune out, Dr.
No, I appreciate you all giving us the platform to talk about this. As you mentioned, if you're coming tomorrow, we welcome you to be there. Please go on our website, zionchurch.org/BMMT, Black Moms Matter Too, to register for that. And as a final word, when we have a crisis in our communities, when Black mothers are dying at a rate 2 times greater than other races, this is something where we all need to raise up and be concerned about. And we're excited for anybody who's looking forward to partner with us and your community around how to address some of these issues. Thank you so much for the opportunity this morning to share.
Thank you. We will be back on the 14th with more updates about Black maternal health. Thank you to Dr. Madye, and thank you for turning in to Win TV with us with Washington Informer. Have a great day.